Hi, it's Tamara, author of the Trauma Beat book and host of this, the Trauma Beat podcast. If you're a regular listener, or if you've read my book, you'll know that a lot of my research regarding the media and trauma survivors involved the coverage of traffic fatalities, sexual violence, mass violence, and homicides, with many of the incidents of mass violence and homicides related to gun violence. But something my research did not look at was the impact of the media on those who are shot and survive. The reason? Because as a reporter, I rarely interacted with people who were shot and survived. In fact, where I spent most of my career, in Toronto, unless a shooting victim died, their shooting event was unlikely to make the news in any significant way. As if someone being shot was not newsworthy. Think about that. This, despite the fact that most people who are shot do survive. As a crime reporter, what kind of picture was I painting of gun violence if I was only ever reporting on the people who were killed? For starters, not a very accurate one. This week's guests have made me think more about the impact of gun violence reporting on not only those who are shot and survive, but on their communities and society more broadly. They're from the Philadelphia Center for Gun Violence Reporting, or PCGVR, and the work they're doing is incredible. Now, full disclosure, in the couple of months since we recorded this conversation, I began doing some work with PCGVR, as our research and our goals are so closely aligned. All right, here's the conversation. Okay, so we have two guests today, so I'm going to go one at a time. Jim, can you just start out by introducing yourself?
Hi, thank you. I'm Jim MacMillan. I'm the founder and director of the Philadelphia Center for Gun Violence Reporting. I've spent about 40 years in journalism, mostly in photojournalism, but for the past 15 years or so, I've been working in journalism, education, nonprofits, and other journalism startups.
Okay, awesome. Jessica, how about you?
Hi, I'm Jessica Beard. I'm a trauma surgeon at Temple University Hospital. I'm also the director of research for the Philadelphia Center for Gun Violence Reporting and a fellow at the Stone Lean Foundation.
All right. This is a conversation that I'm really excited to be having because, like a lot of conversations in season 2 of this podcast, you guys are doing something really outside of the box when it comes to telling these very important stories of trauma better and really in a very different way. So let's just dive in. So Jim, you mentioned that you were a photojournalist for many years. You are also, very humble, I know, but you are a very good photojournalist. You spent 17 years at the Philadelphia Daily News. You and your team were awarded the Pulitzer Prize for your coverage of the Iraq War. Can you tell me, before we get into your work with PCGVR, what was your impression of how the media covered gun violence when you were in that role on the ground, actually taking those photos?
Well, I mean, for context, my generation of journalists, including photojournalists, was really conditioned to try to be objective, to observe and report. We didn't talk about impact very much at all, almost never, and never mind unintended consequences. If there was a theory of change in 20th century newsrooms, it was that we should illuminate social problems, and that would, thus hold leaders accountable, and that would lead to improved conditions. Also, we for the most part, took official information and delivered it as the truth.
Mm-hmm. I think that, I am younger than you, Jim, but me even coming up in journalism in the early 2000s, I would say it was the same. And I think that there's a lot of journalists who are still around today who it's the same. You're expected to be this objective fly on the wall, and you just report the facts and you hand them to the public and let them, do with them as they may. So, Jim, how did you get from there to here with the Philadelphia Center for Gun Violence Reporting?
So it was a journey. It's still a journey. My path won't work for everyone. I was a street level news photographer for more than 20 years, and then at one point I won some big awards, and suddenly my life changed. My career changed. My life was filled with fellowships and residencies and faculty appointments, and thus I was exposed to many more perspectives rather than just hearing from my peers doing the same thing every day, which is the world I had lived in. Also, to be honest, I was kind of corralled into violence prevention work in the community in Philadelphia. And perhaps obviously it's the best thing that ever happened to me, both in terms of learning more about the issue and also earning trust and finding a place in the community where I could maybe get more done. And then finally, a mutual friend introduced me to Dr. Beard about 5 years ago, 5.5 years ago now. I had been teaching a course on addressing violence through the practice of solutions journalism, and it sounds as if Dr. Beard was talking about public health responses, and this mutual friend noticed that, well, he thought we were saying the same thing, and we met, we immediately connected. We wrote a newspaper opinion piece together, maybe that week, calling for better gun violence reporting, and since then we really just haven't stopped.
Okay, I feel like we need to expand on a little bit of what you said, Jim. And Jessica, I'm going to bring you in a minute. But when you say, Jim, that you were kind of corralled into this sort of work, how did that come about? I know you did a fellowship at the Dart Center. Is that sort of kind of what steered you there, or were there other intervening events?
There's a pretty straight line through, and we've never talked about this, so it's interesting that you spotted that. Yeah, so in 2006 or 7, I was an Augsburg Fellow with the Dart Center for Journalism and Trauma, which is now based at Columbia, and they as in fall, and I also spent the year before that actually studying journalism and trauma at the University of Michigan on a Knight Wallace Fellowship. And both of those were important and led me to teach what I still understand. I generally avoid superlatives, but what I understand may be the first undergraduate course on the topic back here where I am now at Temple University in 2008 and 2009. And it was during that course, I really learned that topic inside out, but I hadn't really learned a lot about teaching. So perhaps unsurprisingly, I brought in a lot of guests. And one of the guests I brought in is she's a household name in Philadelphia, Dr. Dorothy Johnson Spite is the founder and director of Mothers in Charge, a group where I'm biased. I have since volunteered and I'm still on the board. Dr. Johnson Spite lost her son to gun violence a little more than 20 years ago in Philadelphia. But I invited her to talk to my drama class one day and suggested, and I said, she was just there for the first half of the class. And I said that thing we all say to be polite. Let me know if I can return the favor. And I think she went down to the car and texted 10 things I could do. So,
I love that.
Yeah, exactly. But it really, it benefited me in two ways. One, it was my invitation into the community from a perspective where I didn't belong until I was invited. But I have learned a great deal from her about nonprofit leadership as well, and corralling people into work that way.
It's kind of, you got to have it as part of it, right? Okay, one more question for you, Jim, before we go on to Jessica. I'm just curious, what was it that made you interested in exploring journalism and trauma? Because you had photographed it for so many years as that objective journalist. Are you comfortable talking about that? Was there something that happened, or is it something that was always sort of on your mind throughout your photography career?
Yeah, there are a few things that happened, and there's one I'm thinking I probably shouldn't tell you about. But the in the broader picture, I would contend. So if you think about it, right, I'm born in the '60s, and I'm old enough to remember Vietnam. I'm not old enough to be vulnerable to the draft, but my older brother was, and I sort of feel like from Vietnam until September 11th, this was a much more peaceful country. There was sure there were covert wars and all sorts of injustice, but it was very different than now. And starting with the attacks on September 11th and then the wars in Afghanistan and Iraq, things were very, very different. And they were very, very different for American journalists. So lots of my colleagues were going off to report from Afghanistan and Iran and going through hostile environment training. And then I eventually went to Iraq. But it was actually maybe before that I started to notice the difference in the journalists who were exposed to a new level of trauma and that was going unserved and unrecognized by I didn't understand it at the time, going without care, going untreated. And I wanted to be part of the solution. I went into trauma journalism at first to help my colleagues, and yeah, sure, to some extent help myself. And then I learned more about the rest of the DART agenda addresses our responsibilities to the people we cover and how we affect them when we engage them at traumatic events and in the way that we portray them, in the way that we affect our audiences with traumatic content. And I could go on all day. So there was a sort of high level agenda there of feeling the need to help pay back the profession. And yeah, there was a pretty explicit incident with a friend of mine, and he's okay. He's still with us. He's okay. That was really the turning point.
All right. Thank you for sharing that, Jim. The reason I asked is because like my reaction from the reaction I receive from journalists when I talk about this stuff is pretty overwhelmingly, I'm so happy that somebody's talking about it, because everybody, whether there was one story that they covered or just a nagging feeling throughout their career or having an incident with a close friend, and that's something that I can certainly relate to myself, it's gotten them, it's put it in their brain, and they might not be able to exactly put a punctuation point on it, but thank you for vocalizing that. Okay, so Jessica, before we get into how you came into the fold with Jim, can you just tell me a little bit about your impressions of how the media covers gun violence when you started out in medicine? And I guess it's worth noting too that you, if I remember correctly, you studied medicine on the West Coast, right? In San Francisco, is that right?
Yeah, well, I actually
Okay.
went to medical school on the East Coast, but I
Okay.
did my residency in surgery on the West Coast.
Okay,
Yeah.
so just tell me what your impressions were then, either before you came to Philadelphia or when you came to Philadelphia, of how the media covers these events.
Yeah, and it just for a little bit of background on myself, I'm a trauma surgeon, so that means that my training and my specific medical expertise is focused on taking care of people who are shot and, fixing the injuries related to trauma, both from firearm injury and other injuries as well. And in a city like Philadelphia, that means that I'm an expert on gun violence. And unfortunately, that's something that's developed, throughout my training. And it's become something that's very personal. For me, I've developed relationships with my patients, and I've seen, what gun violence does to communities, both in San Francisco and here in Philadelphia. And so I guess, before kind of building some expertise around kind of communications theory and research on gun violence reporting, my initial impression was just how little of my own perspective was present in the reports that I saw on gun violence, and sort of how little of the humanity or the kind of the human side of gun violence that I see every day in my clinical practice in the hospital was present. I started initially by, going to news stories to try to learn things about my patients that I wasn't able to meet, because sometimes people come and they die when in the midst of taking care of them. And what I found were these episodic crime reports, or what I later learned were episodic crime reports. And it's just something that's so drastically different from the actual experience of being involved and witnessing firearm injury, and honestly seeing a lot of the humanity and the resilience of people who are shot and how they recover. And I thought, this is a public health problem that's so solvable, and this is a reason why it's not being solved, because it's not being presented as such, as something that's preventable, as something that has policy solutions, as something that has a human side. And I'll also say that, the harmful aspects of reporting on gun violence come up in the hospital. They come up in clinical practice. I've had a patient say, I wish I wouldn't have made the news because things were going so well for me, and this is something that's so negative, and I've been exposed in this way. I've had another instance where a person was reported as dead on the news before I was able to notify the person's mother. This was a young person, a child. And finally, we had a really bad instance where one of our patients was reported as dead, which caused the mother to need to call into the ICU and check on the patient, and he wasn't dead. Wow. So, all of those things together, really like the reporting environment and the potential harms of reporting are really affecting people who get shot and their loved ones.
This is your work, Jessica, is so fascinating to me, because I've done a lot of research into the impact of the media on trauma survivors. And a lot of those survivors were connected to gun violence in some way. But when I'm referring to the survivors, I'm referring to the people left behind in a homicide. So the next of kin, right? I don't think there's anybody in my research who was somebody who was shot and survived. And when you talk about episodic reporting, actually, maybe I'll have you expand on that. What do you mean by that term, episodic reporting?
Right. So obviously I didn't invent that term. It comes from the communications literature. And basically what it means is that the report really just focuses in the case of gun violence on a single shooting event. Um, and that's in contrast to thematic reporting, which explores the broader social and cultural context that gun violence happens in and may, present the root causes of gun violence or solutions for gun violence. And another piece of episodic reporting is whose perspective it's presented from. So while episodic reporting can kind of reinforce narratives of individualism, which aren't necessarily helpful in solving gun violence with public health tools, they don't in and of themselves have to be dehumanizing. So an important aspect is also who's the narrator. So we say episodic crime reports, denoting that folks who have been injured by gun violence or their loved ones, their perspectives are missing. And instead, we're just seeing the perspectives of law enforcement as the main or primary narrators. And our research shows that despite decades of research of knowing that episodic crime narratives are harmful, still the vast majority of TV news stories on gun violence in Philadelphia in 2021 are episodic crime reports.
We'll be right back. Okay, so I think back on my own journalism career, and like I started out in newspapers and then I went to television, and I think about like in newspapers, I don't even know how many hundreds of these episodic reports I would have written. A 17-year-old boy was shot at the corner of such and such and such and such last night. Police say they're looking for such and such. Here's an image of the suspect. Or in TV, like it's almost like you can get into formulaic writing where it's like swap out this intersection for this intersection, this sound of gunshots for this sound of gunshots, and it is so common. That said, the thought of going and interviewing somebody who had been shot and survived the day that it happened when I'm reporting it would have been unthinkable. So do you think is that the reason? Is that forgivable, do you think, for journalists who are just, I'm reporting the day of, it's happened, and then the next day we're on to the next thing? Or does there need to be more follow-up with these victims and survivors in the days, weeks, I would say probably now, through my trauma-informed journalism view, months and years that follow?
I think that's a great question. Obviously, being a journalist is a really hard job. I'm not a journalist, so I don't want to say whether or not it's forgivable. I mean, it is just the way that gun violence is reported. I think we can say that it's harmful when you consider the perspectives of the person who was shot. So when we interviewed people who had been shot in the summer of 2021, which was really one of the kind of unfortunately historic peaks in gun violence in the city of Philadelphia. More people were shot in the past several years in Philadelphia than in the 90s, which was sort of the last uptick in gun violence. And when we interviewed people about the reports on their injuries, they described episodic crime reports, and they said they felt dehumanized by those reports. They said they felt that the reports presented them like they were nobody, that they were just a statistic, or, a man shot in North Philly. And I think because of the fact that those narratives are very racialized, even though race is very rarely mentioned, and the fact that there's so much stigma around being shot, even something that I think a journalist might think is objective is actually harmful to the person. It makes them feel dehumanized, and it makes them feel like somebody who's watching that will think that they were up to something. And I think that, is it forgivable? I think now that we know how harmful it is, I would say no. And I think that we really need to consider the perspectives of people who are shot in rethinking how we report on gun violence. If you want to tell a humanizing story, you need to include the human impact of firearm violence. It doesn't necessarily mean talking to somebody who's just been shot the day that they're shot. It might mean talking to somebody who loves them, their teacher, their school principal, a loved one designated by close family members. And it might mean, like what you're suggesting, follow-up stories to kind of document the recovery after a shooting. And I think there's also, other elements of these reports that are harmful aside from the dehumanizing or episodic aspect. For example, one of the things that's really come out in our research is that graphic and explicit content. You mentioned the sound of the gunshots, but, also, in about almost 10% of TV news clips that contain the actual shooting.
Yeah.
Those things that are becoming very clear that they're harmful to people who've experienced gun violence. And at this point, it's really everybody in our society that's experiencing gun violence. So, what we're in our research and in our work, we're really parsing out what those harmful elements are in order to try to minimize them.
Maybe let's just pause for a second here to paint a picture for listeners and viewers outside of Philadelphia of what the gun violence situation is there. Because Jessica, you mentioned you're a trauma surgeon and you work at the busiest hospital in all of Pennsylvania for gunshot victims, right? Can you just maybe paint us a picture of what the gun violence problem is so we can get a feel for the scale of what we're talking about?
Yes. So, in cities across the country, in the United States, gun violence is a huge problem. Interpersonal gun violence, or what in public health we call community firearm violence. And that encompasses fatal and non-fatal shootings that occur as a result of interpersonal violence. Gun violence is actually a very wide disease. There's also self-inflicted firearm injuries, which are very often fatal, and what we call unintentional injuries. One of the main problems that we have in the research of gun violence is that up until very recently, it was unfunded. It remains underfunded, and there was actually a congressional ban on researching gun violence. So even some things as basic as the numbers, we don't have great access to, especially for non-fatal interpersonal shootings. So we actually in Philadelphia followed the police data. The police have a public database of shooting victims that's updated regularly. And that's how we do our research on the epidemiology of gun violence. So I would say in Philadelphia, gun violence is a major threat to public health. Unfortunately, during COVID, our research showed that the rate of shootings actually doubled following the containment policies in March of 2020. And we've slowly been kind of coming back to our unacceptably high rate of gun violence, but we're out of that surge. It hasn't been the same in cities across the country. There have been kind of different surges at different times, or even in some cities, no apparent pandemic related surge. What we know about gun violence in Philadelphia and in cities across the country is that its root causes are very much centered in structural and systemic disadvantage. Our research has shown that gun violence and shootings occur in neighborhoods that were previously redlined, which was a racist practice that prevented Black people from getting mortgages to own homes back in the 1930s. And gun violence, its incidence is spatially related to, other forms of disinvestment and kind of lack of access to social services. So it really is a social and structural disease, if you will, that is disparately impacts people from structurally marginalized racial groups. And the reason why is because it's by design. Structural racism is definitely the antecedent to gun violence. And as such, it is the leading cause of death for children in the United States now, and the leading cause of death for young Black men as well.
I want to get into some of the terminology you're using around gun violence being a disease, Jessica, because that's really popping out for me, and the whole idea of this being a public health issue. But Jim, can you first just expand on how your two worlds came together, you and Jessica? How did this union come about, the former journalist and the trauma surgeon working together to try to change the way that gun violence is reported in your city?
I don't even know where to start. I mean, I can tell you where it started, but there have been so many steps, I'm not sure which ones to pull out. But as I said earlier, a mutual friend introduced us who noticed that we were saying the same things coming from different perspectives. I mentioned we wrote that opinion piece. What I didn't mention was that there was, I anyway got some enormous reinforcing feedback, mostly on back channels. People that didn't always want to own it publicly were saying, you're really onto something. Of course you have to do this. Of course it will work. It's the missing link. You have to do it.
Oh my God, I've heard that so many times. It's like, okay, give me the money to do it. Give me the resources to do it. Yeah. Continue.
Exactly. I was moving along at my own pace anyway, because I had I had landed this fellowship at the Reynolds Journalism Institute at the University of Missouri, basically to build this thing. And the idea was that I would organize a national conference on the topic, develop a set of best practices based on that conference, a preliminary set, and build an enduring organization. Well, it turned out that Dr. Beard just leaned in at every turn at that conference, which was a huge lift. It's something I'd never done before. She curated, moderated, and presented in the closing panel. Which is really typical of the person I've had the great fortune to work with, and it's helped in so many other ways. And then I feel like it was not long after that she started looking into the Stoneleigh Foundation Fellowship that supports her work, and gave her that opportunity to work with us, or gave us all this opportunity to work with her. Do you want to talk about those steps, Jessica?
Sure. I think, for me, it's been really such a pleasure and amazing. And I could say all of the same things about you too, Jim. I think for me, it's so clear that it's something very important, for our patients. Part of being a doctor, which is very different than being a journalist, is your requirement to be a patient advocate. The American Medical Association actually says I need to be a patient advocate. And for me, my patients are people who've been shot. So gun violence prevention is very important to me. And so that's really where it stems from. And I think, what Jim's kind of helped me to do is to kind of get outside of the hospital and into a space where, there's engagement with community, and we bring scholars into the space, and we're kind of very collaborative. So that's been really great.
I love it. Okay, so Jessica, now talk to me about gun violence as a disease and why it is important for us to think about it through that lens when we're considering how we're telling these stories to the public as journalists.
Yeah, so I think for a long time, gun violence has been framed through the lens of crime. And by definition, then the tools that we have to stop gun violence are the tools of law enforcement and policing. And the truth is that there's very little evidence or no evidence that policing interventions can prevent gun violence in a sustained way. And that's, it's the same way that trauma surgery doesn't prevent gun violence, right? When I'm operating on a patient, I'm helping that individual, but I'm not actually stopping gun violence before it starts. So really, the thing that can prevent violence is public health and tools of public health. And what COVID in the United States laid bare is that our public health system is extremely disinvested. Our health system is overly invested. Our law enforcement approach and our policing system is overly invested. And that really is to the detriment of a system that could prevent disease. And you can see in other places, like, for example, no other high-income country has gun violence like we do, because there are policies that prevent gun violence, that limit gun ownership. But there's also policies that, give people access to healthcare and address social inequities. And those are all sort of the antecedent parts that place someone at risk of gun violence. So what would it mean to report about gun violence as a public health problem? I think it would center on the idea that it's not inevitable, that it's preventable. And it's not something that we have to live with. It's actually something that can be stopped. What we kind of posit a public health frame of gun violence as opposed to an episodic crime frame would look like in reporting would be to present an epidemiologic context. So an example of that would be if you're reporting on a child being shot, you might say, while it seems that the rate of shooting of children is increasing slightly, in the kind of post-pandemic period, a child being shot is still a very rare occurrence. Only 7% of people who get shot in Philadelphia are children, for example. One of the big challenges of presenting numbers is sometimes people who are impacted by gun violence personally have told us that it feels dehumanizing, or it feels like a race to get to a certain number. So I think that's what we mean when we say epidemiologic context. Same thing for a mass shooting, right? We find in our research is that rare shootings are overreported compared to their frequency. So shootings of women, shootings of children, and mass shootings are overrepresented. They're more likely to make the news. So, and we understand that rare things are potentially more newsworthy, but providing context would mean if you're reporting on a mass shooting, you would say, there is a shooting like this once every 2 months in Philadelphia, for example. I mean, providing that kind of context. Public health reporting would also include root causes. And not root causes like where's the father, right? Root causes like mass incarceration, root causes like systemic racism, root causes like, systemic disinvestment in people and places. And figuring out how to fit that into existing narratives can be a challenge, but we actually have some tools and some suggested language to use that we've been developing. Public health reporting would include public health visuals, so not just visuals of the crime scene, but visuals of a community event or of a community activity around gun violence prevention, or actually, an interview with a survivor or family member, and narrators again. So a community representative, a public health professional. In the sample of clips, we have 7,000 TV news clips, and we sampled a subset of those. We never saw a doctor or a public health professional as a narrator in any of those clips. And in only about 7% of clips did we see a firearm-injured person, their neighbor, or their family member as a narrator. And then finally, solutions. Jim mentioned solutions journalism. In our research, really, we found that no TV news reports in the summer of 2021 incorporated all of the elements of solutions journalism. So it's non-existent on television news in Philadelphia. But I think that it's really kind of a very important part of presenting that public health approach. Only 2% of the clips even included the word prevent. So I think figuring out how to frame gun violence as preventable is really at the crux of a public health approach to reporting.
So I imagine, just putting on my former journalism hat and knowing many journalists that are still in the field, that some of the feedback that you guys might have gotten from the journalism community is, how do we do this when we don't have enough staff to cover everything? How do we do it when there are X number of shootings in a week and we, after one happens, we need to rush off to the next one? How are you guys, and Jim, maybe I'll put this to you, how are you selling this to newsrooms as something that they need to figure out how to do it differently, even given today's news landscape, the competition that's involved, the lack of resources, all of that stuff?
Thanks. I think the specifics, well, you can generalize. I think the specifics can vary across newsrooms and for individuals. But first of all, I try to come from a place of respect. I know firsthand that it's very hard work, often done in very difficult conditions, and that you get to carry all that trauma home at the end of the day or throughout the rest of your life. And I want journalists out there to know, to begin with, I admire them. I want them to know that we care about them. And of course, we know that they care about the work that they do. I believe that most have the best of intentions, that they want to have even if they don't think about it like nonprofit impact, but they want to have a positive effect. They certainly don't want to do any harm. And that's where I come in and say, well, it's because you care, because I know you care. I believe you care. I know you care, that you should look at this information we have, what we've gathered. We've got some new information, and it will help you do a better job. It's not, and then it's not just our opinions. It comes from, extensive community engagement programs and projects and scientific data. It comes from our research. It's a really, valuable kind of, almost like business intelligence. But for you, if you want to, engage audiences, and especially if you want to make a difference.
Jessica, speaking of data, something that I found really interesting that you mentioned in another podcast that I had heard and that first brought me to you guys was the bit about all the research that's been done on how we report on suicides. And it's interesting because my entire journalism career it was known that you don't report on suicides unless there is a specific reason you're doing so, but also like the reason behind that is because all this research that showed, if you report the mechanism of suicide, then that can drive up suicides. If so journalists have adapted to that by either not reporting on things or adding resources to the end of news stories when they do report on things. So, I mean, why do you think, maybe I should ask you first, like when it comes to data, because you're obviously working hard, you're a very widely published public health researcher. You're working hard to create this data for reporters. Do you have any thoughts on why we haven't been looking into this like we have other issues? I think you mentioned that there were like hundreds of journal articles that have been written about reporting on suicides, but there's really hardly anything. And I found the same in my research when it comes to media and trauma.
I think there's a couple different reasons for this. And of course, this is all my own conjecture. The first one is that it's a little bit easier to draw the connection between reporting and suicide. Gun violence is more kind of ecological and exists within, it's more complex. It exists within social networks. So not that the research is easier, but drawing the connection between over-reporting or harmful reporting on a suicide incident and the incidence of suicide is much more straightforward. The second reason I think is that most of that research is done by European researchers. And when I met with one of kind of the preeminent suicide researchers about our work on gun violence reporting, it was like, good luck, gun violence isn't a problem in Europe, right? Not in a negative way, but just it's on us. So we can't just rely on Europeans to do this kind of high impact research for us.
Wow.
And I think, related to that, unfortunately, is, the people that interpersonal or community firearm violence is impacting in the United States are the reason why the system is kind of allowed to persist is because these are people who are structurally marginalized by policies in the United States. So Jim and I talk a lot about how the reporting is harmful. The reporting may be leading even to an increase in the incidence of gun violence, but the reporting is also a reflection. It's a mirror up to how we are dealing with gun violence in our society, right? We are investing in policing and law enforcement interventions. We are not investing in public health interventions. We have thousands of police officers in Philadelphia and less than 10 people working on gun violence as a public health problem in the city. So while it itself is harmful, also what's harmful is the approach that we are taking to gun violence and the fact that we are not using the tools of public health to prevent gun violence. The question that you asked Jim about how do we engage with journalists, I think is a great one. One of the things that we have always tried to do is involve journalists and also people with lived experience in our process. So, from the very beginning, we have invited journalists into discussion. We had a human-centered design workshop back in the fall of 2022 that brought together journalists, people with lived experience, and scholars to imagine better gun violence reporting. So it's not as if anyone's coming and saying, this is better gun violence reporting. It's more like, let's work together to come up with ways to make gun violence reporting better. We have a kind of drafted version, soon to be finalized version of better gun violence reporting guidelines, or a toolkit that we worked with Frameworks Institute to develop. And that came directly out of the workshop. And it was built on listening sessions with journalists who have been engaged in our work and iterated with feedback from journalists who are maybe more naysayers of our work. So I think that we are not attempting to, create recommendations that are, without the input of people who are stakeholders. And then I will just say one kind of interesting piece of information about reporting that we've gleaned from our research is that when we compare episodic and thematic reports on Philadelphia TV news, the thematic reports, while they contain far less harmful elements, are not longer than the episodic reports. They're both short. So in terms of the amount of time that thematic reports, or reports that include the context that in which gun violence occurs, aren't going to take up more airtime necessarily. And so like it is also part of the reason why we've chosen to focus on minimizing harms and defining harms and achieving consensus around harms, is that even in the frame of an episodic report, you can minimize harm too.
We'll be right back. So I love, like, something I love that Jim, you said a moment ago was, talking to journalists and saying, and just recognizing you don't want to do harm, and I hear the same thing from journalists too all the time. Like, oh my God, I had no idea that all these things that I do on a daily basis, and I was one of those people, were causing harm. So I wonder, and I'll give this question to whoever wants to pick it up, but what is your reaction from journalists been in terms of when you present them with your research, that shows what the impact of their reports have had on some of your patients? And I know, like, some of the patients that were involved in your research, Jessica, had actually watched news reports of their own shootings. When you present your research to them, is there anything that is surprising for them, or is a light bulb moment more often than not that they just consistently just didn't realize they were doing irresponsibly, I guess I'll say?
I think there is a spectrum of responses. I think there's people who really understand and are already trying to minimize harm in their reporting and tell, solution stories. And those are people who have been really engaged in our work. And I think there, on the other end of the spectrum, are, folks who still have trouble seeing that episodic crime reporting could be harmful. And qualitative research or the content analysis, it's just not enough to kind of convince them that the work is harmful. And I think some of it has to do with this just kind of entrenched idea that the police are the authorities on gun violence, and sort of an inability to recognize that the potential harms of relying on the police to tell stories that are fundamentally, largely about young Black men in cities. And obviously we know that, the police are not a reliable source of information, but because, a lot of times journalism does sort of rely on or holds this mirror up to official sources and kind of privilege those sources over people with lived experience. That's kind of the cycle that we're in.
So let me just pause you just on that
Yeah.
point. Sorry to interrupt, Jessica, because there's going to be police officers who are listening to this. I know that of some in Canada that listen to it, because I encourage it, because I want law enforcement agencies to do a better job of supporting their survivors, their clients, with things like the media. Expand on that, your point of, we know that they're not reliable sources. Are you referring to facts that have happened, or are you referring to the fact that they're not giving a broad enough picture of something when they're relaying it to the media? Just expand on what you mean by that.
So one of the things that we know in helping survivors who've experienced trauma to tell their stories is that accuracy really matters. And one of the things that we found that was particularly harmful to people in our research was inaccuracies in the news reports. So that's what I'm referring to, at least in a small part. So, even the number of gunshot wounds, or what we would call the clinical condition of the person. One of the participants in our research study said the news report said that I was shot 4 times and that I was in critical condition. And I knew that I was shot twice because he had counted, the the gunshots differently. And I knew that I was fine. And my grandmother was watching this news report and she was really upset, thinking that, I'm going to die when I know I'm fine. So I think that's kind of a benign example, not to the person, obviously, that the news report was about, but it's a relatively benign example of how, they just get the story wrong and then journalists publish it as news and it's fundamentally inaccurate from the perspective of the person.
And I'll just jump in on that and point out that I heard very similar sentiments from homicide survivors in my research, where the whole idea of misinformation. So beyond just, that grandmother thinking, like worrying more than she perhaps needed to, I was also hit with the sense of, why is my story not important enough to get it right? Or, do I just not matter enough to get it right? One mother said that, or sorry, not one mother, but one homicide survivor, her loved one was reported on one news station as having been shot in the head, and another news station as having been shot in the back. And I'll just reiterate how harmful that can be, whether the patient survives or not. So continue, Jessica.
Right. And I think, it's related to the fact that you had no control over the narrative, that you weren't consulted, that it's not your story. Other things like one person in our study described how the news report said that he was riddled with bullets, right? So what's riddled mean? Well, what riddled means is that you were the target, that you are a bad person, that you had it coming. And he said, but I was actually asleep in bed, and that's what everybody thinks about me now, that's the way that I was described. So those are sort of like the inaccuracies that are just basic information. And I think that sometimes what I hear journalists say is, oh, well, these are the official sources, so I'm going to report it like news. But I don't know that in any other instance that they would report that as news with just one source, if that makes sense, without fact checking. And of course, the person that it should be fact checked with is the victim. And then I think sort of a more kind of negative aspect is when a police officer or a law enforcement officer shoots a person, we oftentimes get very inaccurate news reports. We had a mass shooting here in Philadelphia, and some of the early reporting neglected to mention that the shooter had actually shot somebody else, and that like a day before.
Right.
And that person was counted in the victim count of the mass shooting. And so there's a lot of obscuring of information that's not even in an officer involved shooting or a shooting where a police officer, kills somebody, but was just around in a mass shooting related to the police investigation. So, I mean, I guess I would just say that, I think that one of the kind of ethical principles of journalism, according to the Society of Professional Journalists Code of Ethics, is that you don't tell one source stories, that you would be kind of fact checking really anything that you're reporting. So that's kind of the simplest way to think about it. And then sort of the more kind of complex way to think about, policing and policing's relationship with people living in under-resourced communities is that, it's not one of trust. It's oftentimes an adversarial relationship where, police certainly are not the experts on the experience of somebody coming from a marginalized community.
Okay, so one thing I love about your organization is that while you are saying you can't just get one source, you talk to people in the community, all of that stuff, the natural response from journalists is going to be, well, who's going to want to talk to us? But you guys are actually creating circumstances where there are people with lived experience who are there to act as these ambassadors, if you will, when it comes to reporting on gun violence. So Jim, why don't you tell me a little bit about the sort of work that the Philadelphia Center for Gun Violence Reporting is doing to actually assist journalists in telling these stories in a more public health informed and I'll say trauma informed way.
Okay, so again, difficult to summarize. We've done so many things, but at the crux of our work, our secret sauce, so to speak, is bringing people with extensive lived experience together with journalists who report on the topic and researchers focused on prevention. And so I could tell you how that's broken down in every everything we do. But for instance, last fall in November, we held our most recent workshop. It was we called it our Gun Violence Prevention Reporting Certification Workshop, and we had 20 journalists participate from around Philadelphia. We've had journalists from every news organization participate in some of our workshops, but this one we had most of them, and we brought in a handful of others from around the country. But we also brought in 15 community leaders, people with lived experience or like real expertise in leading gun violence prevention communities, and even more than the expertise that anyone impacted might have. And we want their eyes on everything we do. We want them. And then we have them review everything we produce. And we don't feel like I'll speak for myself. I don't feel like we'd have much authority. We'd have a certain kind of authority, but we wouldn't have comprehensive authority without them.
Mm-hmm. Jessica, do you want to expand on any of that?
Yeah, I mean, I think we have an NIH grant to really build science around what is harmful reporting on community firearm violence or gun violence. And we worked with Jim and PCGVR to identify people to participate in what's called a Delphi consensus. So a group of anonymous people coming together to really define what's harmful. And we had 21 participants. We just finished 3 rounds of surveys, and we have people with lived experience, community leaders, journalists, and scholars all kind of together. The point of it being anonymous is that not one person's voice can overshadow another person's. And what we've come up with is what constitutes the harmful elements that make gun violence reporting harmful, essentially.
And you've touched on a number of those, the showing the videos, I suppose, the misinformation. Is there anything else you wanted to highlight that we haven't talked about yet in terms of what makes a gun violence report harmful?
Yeah, I mean, I think we achieved consensus that episodic reports are harmful, that reports that exclusively or largely include the perspectives of law enforcement and not people from the impacted community are harmful. And reports that include graphic or explicit content, those I think are, very strongly felt to be severely harmful. And there's a lot of questions in journalism about that, I think, but at least our group of experts feels that those are not going to be helpful. Certain reporting elements, so the number of gunshot wounds, the relationship between the victim and the shooter, which is often inaccurate, the clinical condition of the victim, the treating hospital, that's often mentioned in reports in Philadelphia. And
in terms of it being a safety concern, is that what you're referring to in terms of it being?
Yeah.
I mean, yeah, because again, lots of the people that I reported on as a journalist, and this is one of the problems with gun violence reporting, I understand now, they were deceased, because we are more likely to report on a shooting that was fatal than non-fatal. But yeah, if there's somebody is living, and I have done this report, and they're in that hospital, understandably so, if somebody was trying to kill them and they didn't succeed and they know where they are, that would present a real concern.
Yep. And reports that don't include the perspective of the victim and their loved ones. Yeah, so I think it's sort of reiterated the qualitative research that we did with firearm-injured people, but really added some different perspectives, which has been great.
So you guys have done so much stuff. You've had workshops with reporters. You've created this set of guidelines, which is, as you mentioned, is soon to be published. It might be published by the time this is broadcast, and if that's the case, then I'll absolutely include a link in the show notes. You've been working with survivors who are sharing their stories with journalists. My question to you both is it working? Are you seeing a difference in the way that gun violence is being reported in Philadelphia? To whoever wants it.
Well, I can start. So, we haven't comprehensively measured our impact yet, but things are happening undeniably. For instance, reporting from a public health perspective also is almost synonymous with reporting from the perspective of prevention rather than reporting an incidence of violence. And related to that, WHYY Public Radio here in Philadelphia hired 2 gun violence prevention reporters last year. The first time I've ever heard of that role.
Two of them. It's hard for newsrooms to even get like one city hall reporter or one, whatever. Anyway, that's remarkable. So that is a direct result of your work that you've been doing.
So it's hard to be certain, but we did hold that first summit during my fellowship that I mentioned earlier at WHYY. They didn't engage me on the job description, but it looked a whole lot like the set of best practices that we published after the conference. So
Wow.
So I think there was some intersection there. Those two have gone on to other things recently, but a friend of mine mentioned that he might be applying. It was a while ago, but that there was another opening for the same role there. At the same time, and it's also part of WHYY, but the city's most prominent digital first news site is called Billy Penn, and they have gun violence prevention on their main menu, like next to weather and sports and things like that. And the annual Philadelphia News Awards created a gun violence prevention reporting category this year for the first time. Ellie Rushing at the Philadelphia Inquirer won it just last week. Another sort of proof of concept for me is that, as I mentioned, somebody from literally every Philadelphia newsroom has participated in our programs. In fact, in one of the workshops alone, everybody was there. There was somebody from every TV station, the legacy news company, news radio, public radio, digital first media, community news, ethnic media, whatever I'm forgetting. And that's local. At the same time, nationally, I think we're having more of a reach and finding more intersections. The Association of Public Health Journalists had a conference uncovering gun violence as a public health issue. I feel like about 18 months ago, and invited a few of us out to participate. The Radio, Television, and Digital News Association recently had a conference, a summit on reporting crime, I think they called it. But they had a lot of people with some progressive ideas about the future of journalism on that. At that conference, the Poynter Institute and many others have new courses on improving reporting on criminal justice writ large. Where we laser focus on gun violence, but there's an indisputable movement locally and nationally.
Awesome, Jessica.
I think you're absolutely right. Like, what we need to do is show impact on reporting. So we do have plans for that. We have some tools, guidelines. We have building relationships with television news teams. So that's our next goal, is to actually take our guidelines and our documentary, The Second Trauma, that we have been screening around. That's produced by Aronde McLean and Yvonne Laddie, and feature some of our research from PCGVR, but take those tools that we have now into newsrooms and really see if we can impact it and minimize harmful reporting.
I think that, like what you just touched on in terms of showing them the impact on reporting, is so key in selling something to journalists, because in addition to what you said earlier in the conversation, Jessica, about getting some pushback on journalists who might think that law enforcement is the go-to source on things, I think where I get some pushback, where I do get pushback on my work, is also in the sense that, journalists are inherently entitled, which is a good thing when you're reporting, holding politicians to account, but not necessarily a good thing when they just want the total control of something. And if somebody comes in and says, you need to change the way you do things, there's some newsroom managers and journalists who are just going to get their backs up, because it's like, you can't come in and have any control over the way I'm reporting. I need that editorial independence. But what you just pointed out about the impact on reporting, I think you've already made the case on a very good point, which is the misinformation. I mean, I tell journalists, in terms of interviewing trauma survivors in the immediate aftermath of a traumatic event, one of the reasons that that's not a good thing is A, because it can be harmful for the survivor, but B, because you might not get an accurate story, because the way that trauma impacts the brain. And what you're saying is reporting facts from law enforcement in Philadelphia in the immediate aftermath of a traumatic event. If your job is to tell the public an accurate description of what happened, you might not actually be doing that, because you're not giving an accurate description of what happened. So I'm really looking forward to seeing, and you kind of had a smile on your face there when you were talking about how you're working on bringing that sort of stuff together. I'm really looking forward to seeing what other impacts you have on reporting. Now, I want to ask both of you, because anyone who listens to this podcast regularly knows that I'm an advocate for trauma-informed journalism and storytelling. And I wanted to ask you both, is your work about trauma-informed journalism? Is it just about public health? Are those both inherently, do they go together? Is it both? Jessica, maybe I'll start with you on that one.
I think that's a great question. What we're imagining is fundamentally kind of a novel discipline that we've called gun violence prevention reporting. Jim mentioned we held an inaugural training, and that kind of area of journalism draws on different, aspects of journalism and different skills that journalists need to have. So absolutely, the ideal or the better gun violence reporting would be trauma informed. It would have a public health frame, it would present solutions, and it would incorporate perspectives from peace journalism, focus less on conflict and more on solutions, more on community, more on collective efficacy. So what would it mean to be trauma informed and reporting on gun violence? I think it would mean limiting graphic content and explicit content. It would mean obtaining informed consent from people who've experienced gun violence that you're interviewing, which might also include sharing, the quotes that you're going to use, or even, the story that they're included in. I mean, frankly, when I interact with journalists, I have a communications team at Temple at my hospital, and they oftentimes do that for me, right? So it's not
they show you their stories?
Sometimes, yeah.
Oh, wow. Okay, that's so interesting, because that is the one thing I advocate for all the time, is showing trauma survivors the story ahead of time to take away that element of surprise, but also to make sure it's factually correct. And that is the one thing that I get the biggest pushback on. So isn't that interesting that they would be willing to do it for you, who they're going to as a subject matter expert, and who they're not interviewing necessarily because of the trauma that you've experienced, but that they wouldn't necessarily be willing to do it for the primary trauma survivor.
I've interacted with a lot of journalists who've offered to have me check my quotations. So, I think that should be standard practice to be trauma informed, in my opinion. And it's not just my opinion, it's recommended by, by you and all of the leading experts in trauma informed journalistic practices. I think, thinking about how you approach someone in the immediate aftermath of a shooting, and potentially just kind of rethinking whether it's right to tell the story then, or waiting for a follow-up story is more appropriate, is trauma informed. And frankly, I think we can all be trauma informed in what we do. Some of the other work that I am focused on is delivering trauma informed care in the hospital, right, to firearm injured people. So I think it's really something that for every person that interacts with a gun violence survivor are skills that we need.
Jim, what about you? Do you see the work you do as being about trauma-informed journalism, or is it public health, or is it both? Are they inexplicably intertwined?
Inexplicably, I don't think so. But I mean, this circles back to that friend that I mentioned. And so from my perspective, that friend I mentioned who noticed the common threads. But from my perspective, I've had the opportunity through all those, fellowships and such that I mentioned, and teaching opportunities. I've had the opportunity to study and teach and strive to practice some specific disciplines, sort of journalism ideals, traditions of trauma-informed journalism, or we might just call trauma journalism, or solutions journalism and peace journalism. And I owe a lot of that, the roots of that really come from my opportunities to study with the Dart Center in particular, and some other opportunities. But when it comes to solutions, the actual solutions to gun violence, I think they come from public health. And I spent a lot of time reading about gun violence prevention, but we've got a much more authoritative expert here, so I leave it to Dr. Beard.
Okay, and I should correct myself. Inescapably intertwined, not inexplicably. It is very easy to explain that. All right, but for both of you, I just wonder how you see your work expanding. What are your goals, and also what advice you would give to organizations in other parts of the country and the world who want to do something similar? I imagine there's been a lot of lessons learned along the way. Jim, do you want to start with that one?
I mean, first of all, forgive me, like, follow, and subscribe, but seriously, we have a lot of resources on our homepage that rotate through our homepage, and you can find more deeply on our site through our directory, and it's a good place to start. But also start where in the same places where I've learned it all, at the DART Center site, dartcenter.org, at the Solutions Journalism Network. When it comes to peace journalism, actually, the Wikipedia is a terrific source. It's
Yeah, because
all.
I hadn't heard that term before, peace journalism. I love that.
Yeah, so I had the opportunity to, like I said, to study and teach peace journalism when I was at Swarthmore about 10 years ago. I learned that it was basically inspired by really the man behind peace and conflict theory, a Norwegian sociologist, Johan Galtung, right? I could go on, I could talk about it forever, but it was really designed around addressing international or civil conflict and focusing on the positive bias and focusing on peace instead of war. I always say, we don't have bankruptcy beats and illness desks. Our news sections are about health and business, right?
Yeah.
And so it's only when we come to war and conflict that we take this negative bias. And while I was not knowing my background on the street, while I was teaching this, I'd have the opportunity to speak at some conferences, and somebody would inevitably raise their hand and say, "Couldn't you say all of that about the crime beat?" And I said, "Exactly, right." So, and that's what we're doing. That's why I'm so excited about talking about prevention from my perspective, while it's also pretty important from the public health perspective. But I digress. The bottom line is all of these resources are at your fingertips, and just take anyone that wants to step into the space to make some time to take care of yourselves and prepare for a long, hard slog. There's going to be work to do here as long as you want to work on it.
Yeah, and I'm just going to throw out your website, and like I said, I'm going to include links in the show notes. But you gave the DART Center's website, but you didn't give your own, Jim. PCGVR.org. Jessica, you're on fellowship, doing your work with PCGVR. So what are the sorts of things that you would like to accomplish in your time with this organization and on this issue? And do you have any advice that you would give to anyone else wanting to do the same work?
Yeah, so as I mentioned, we have an NIH grant, which is pretty historic, since I mentioned before, up until very recently, our kind of governmental research organizations were not funding gun violence research. So that's exciting, and it's also exciting because it's so interdisciplinary. So on our research team, we have Jennifer Midbury, who's a journalism professor at Lehigh University, and we have Chris Morrison, who's an epidemiologist from Columbia. And we have a host of trainees that are participating in our work, and obviously, the people who have contributed to the findings of our work, which include lived experience experts, journalists, and other scholars. And I'm really excited about continuing that collaboration and really building science around better gun violence reporting, identifying harmful reporting, using that to iterate on our guidelines, and then taking those guidelines into newsrooms and working with journalists to adapt them to their context and to make better news content. In journalism research, sort of the gold standard is what they call experiments. So actually showing people news content and gauging how they respond. So our vision is to work with it in real time, use human-centered design to engage with journalists to actually create better news content following our guidelines. See and test how people react to them, and not just college students that are oftentimes in research studies, but people with lived experience of gun violence, iterate on those and really flip the script on gun violence, and do so collaboratively. So that's the goal, and maybe lofty, but
I love that, because there is such a vacuum of research around this stuff. And when you just mentioned those experiments and showing what impact it has on people with lived experience, that is so powerful. You know what else I'd love to see research on? And Jessica, I'm not putting this on you, but maybe, who knows, one day I want to see some research on, what impact does it have showing the body bag, or showing the very graphic video of a shooting happening, in terms of, does it solve the crime? Does it make people vote differently when it comes to, gun legislation or whatever? Because I think that journalists often do things in a certain way because it's just the way it's always been done, and not necessarily because it's been shown to be impactful. Anyway, that's my 2 cents. Is there anything that either of you would like to add before we end this conversation?
I guess for me, as I said, we're seeing a trend. There's an indisputable movement, and Dr. Beard was on a panel recently with the National Press Club. It's on our homepage, perhaps unsurprisingly, but with some young journalists who cover gun violence and prevention, and they were arguing that a change seems inevitable, because as journalists are coming into the field now from the first generation of young people who lived through ubiquitous school shootings and active shooter drills, and so it's not a question for them. They said it's not a question of if, but when you want to get on the right side of this movement and on the right side of history.
Wonderful. Jessica?
I think that's a great way to end. I agree that it's a movement. I think that it's a collaborative effort. I think that working together with people with diverse perspectives, but most importantly, people who have personally been impacted by gun violence, is our way forward.
Wonderful. Jessica, Dr. Jessica Beard, Jim MacMillan, thank you so much for joining me today for this conversation, and thank you for your work. What a model that you guys have created for others to look at and think about how they can report differently on gun violence in their own communities. So thank you.
Thank you very much.